If you're scheduled to have a male sling, generally this will be performed on an outpatient basis. You have to remember not to eat or drink after midnight the night before the surgery. You come in and have the operation, which is usually an hour in terms of surgery. You'll go to the recovery room. You'll stay for a couple of hours after surgery, and you'll go home with a catheter. The reason I send patients home with a catheter is so that they will not have any difficulties urinating that day. By far and away, the majority of patients can urinate the day after surgery, but not everybody wants to stay in the hospital overnight. So after the surgery, you'll come back to my office the following day. We'll remove the catheter, we'll make sure you can urinate, and then you can go home without the catheter. Occasionally, patients will need the catheter for a short while longer. Usually by a week, however, most patients are urinating on their own. The biggest restriction after a male sling is you really need to avoid heavy lifting or straining for about 6 weeks. So if you're physically active, if you like to exercise, you like to run, etc., I'll recommend you don't do that for 6 weeks. You can do light activities such as walking within a couple of days from surgery. You can usually drive within 2 or 3 days after surgery, and most patients will require pain medicine for a short amount of time, but usually by 3 or 4 days after surgery you can be off of all narcotics. Usually what I'll do is see patients back in the office about a week after surgery. We'll check to make sure that there's no evidence of infection. We'll do what's called a bladder scan to make sure patients are still emptying their bladder well. And if all looks good, I'll see you about a month later if we could see how you did in terms of the results of the surgery. If you're scheduled to have an artificial urinary sphincter inserted, we're going to send you some specific instructions. I'll have all patients scrub themselves with a special soap for several days prior to surgery. You'll come into the hospital the day of your operation. We'll perform the surgery, which is usually done in 2 hours or less. You'll stay in the recovery room briefly and then go and get admitted to the hospital. We do keep a small catheter in overnight. By the following morning, the catheter is removed and the majority of patients are able to go home. The reason for admitting patients is to give them appropriate intravenous antibiotics to minimize the chance of an infection, which in our experience is less than 1% risk. Hard part about undergoing a sphincter is that you're not going to be dry from day one because we're not going to activate the device immediately. You need a period of 6 weeks of healing before we can activate the device and teach you how to use it. In this regard, when you leave the hospital, you'll still be leaking. We'll see you at a week after surgery to make sure that the wounds are healing well, that there's no signs of infection, and that the pump is in a good position. Then we'll see you at the 6-week time point, and that day I will teach you how to operate the device. I'll activate it, I'll teach you how to do it yourself, I'll watch you do it and make sure that you can do it, and from that point onwards you should be 95% dry or completely dry. It's a little bit harder to wait, obviously, but you know, the healing period is extremely important. Also during that time we recommend that you avoid any heavy lifting or straining, so if you're into sports that you avoid doing them during that time. By 6 weeks you can get back to most activities, however. In terms of driving, most patients can drive within 2 or 3 days as long as they're not taking any prescription pain relievers. Most patients don't have very much pain after the surgery and can use either Aleve, Motrin, or Tylenol by day 3.